Oh yeah, there we go.
Is that better?
Right? Oh, why are we crooked? These are always the best beginnings of the videos when we're
Thank you.
all right. We are just, let's see, we're trying to adjust all of our technology while we wait as people show up. Sorry, we're running a little bit late. But we're here. One of us is here. Just kidding. Destiny's plugging in my phone. Because I forgot to charge it. Ah, shoot. That's okay. Technical difficulties. Not a big deal, everyone. Nothing to see here. Sorry. Hold on. Okay.
Okay.
All right.
Sorry about that.
Okay.
All right.
Should we start?
Yes. Let's do.
So we have to start off by demonstrating, like, okay, hold on. Let me straighten this out. So it's a little. So you might notice there's a little divider. Look what Des got us.
Yeah.
So we have a little plexiglass divider for anyone concerned about our proximity. And so look at us. Hey, Des. Hey, girl. Hey. All right. Okay, so we'll wait just a little bit and probably say ridiculous things as people show up, and then we will start going. There we go. Look, we're so cute on there.
This is going to make it this a little more difficult. I'll
Yeah.
just write stuff down and you read
Okay.
on my side.
Sounds good. All right. Hello, everybody.
Hello.
Thank you for joining us. All right. What do you think? Aw, lots of love.
Aw,
Thanks,
thanks
Annette.
guys.
Okay, well, we will go ahead and get started, and then we will see what questions come up. And we do want you guys to ask questions. We know there's a lot of stuff going on right now. We'll offer some information, and again, we will just look at your questions. And I guess we can pass it like forward up here if we need, because you'll do some stats.
Yeah.
So, hello everybody. I'm Jen Bacani McKinney, and I'm the Wilson County Health Officer.
And I'm Destiny Wheeler, and I'm the Wilson County Health Department Administrator.
All right. So we will start off by we do have our, Kim Smith mentioned our t-shirts. We have these t-shirts on, of course. They're oldies but goodies.
Mm-hmm.
So anyways, we will start off as we have in the past with statistics, if that sounds good.
Yes, and because I didn't write down the national statistics, I don't have them.
This time.
But we get updated from KDHE every Monday, Wednesday, Friday. So these numbers are from Monday. So I didn't even write down the total numbers, which was probably a bad idea.
We've been a little bit busy, and we're so sorry. We don't mean to be unprepared.
But I did write down that we had 980 new cases over the holiday weekend, which is disturbing because we have surpassed our peak number, our peak day. So we have a new peak. So that's disappointing. But we had 3 deaths over the weekend, and I can't remember. Cassie, I know you're watching. Shoot me how many deaths we have statewide. I'm sorry.
Cassie, if you don't mind sharing some numbers with us, that would be great in the comments.
Yeah. So our numbers are definitely going up. One thing that I want to point out is the number that, because I don't know the total numbers, because what I've been looking at for the most part is the percent positive, which means the number of tests we're doing, number of positive tests out of the tests we're doing. So, thanks, Doug.
It is a plexiglass barrier.
It is,
Yeah,
yes.
see? Just in case anyone wanted to comment on our closeness.
But we have been hanging right around 8 to 8.1% for several weeks. And as of Monday, we're 8.4% positive. So not a huge increase, but definitely an increase, definitely an upward trend. And we want to be really, really careful.
Because prior to that, we've been trending down. Like, we started at our peak, and
it was like 12.
we were like 12% positives, and we weren't at that point. We were testing only symptomatic people, mostly people who had 2 or more symptoms that matched COVID. And so at that time, we were really being choosy with who we're testing. In Wilson County, we're basically testing anybody who wants to be tested, who feels like they need to be tested. We're not saying, no, you can't be tested. So if you see your doctor or you call your doctor and you say, hey, I think I need to be tested, odds are good you're going to be tested, just to let you know. So, but I do think that is really important, because some people say, well, the numbers are going up because we're testing more. That's why percent positive, like Destiny's talking about, that's why it's so important, because we want to compare apples to apples. If our testing rates go up, then what are we? What kind of numbers are we seeing then that are actually our numbers actually going up?
So Cassie provided me with the numbers at the same time that I realized I had pulled them up on the computer that's actually directly behind the screen.
They are. Whoopsie.
It's been a long day, guys. Okay, so 16,901 are our state numbers as of Monday, with 280 deaths.
And we might just mention, and I don't know if you mentioned it already, but we have 4 cases officially in Wilson County.
Yes,
and as of yesterday.
Yeah, and three of those as of today have recovered fully. So we have 1 active case in the county right now, and we have a question.
So,
go ahead.
do you want to, okay,
Nope, you
so
go ahead.
there's a question that aren't deaths and hospitalizations down tremendously? How come there's no talk about that? Why is everyone hush hush on that? So I guess we'll start out by the numbers that Destiny and I pull up are on the KDHE website, so kdheks.gov. Those numbers are everywhere. They're accessible. The only way we get those numbers is from the public website. So those numbers are everywhere. Nobody's trying to hide anything there. We are talking about, we do talk about the number of cases. Destiny talked about the number of deaths a second ago. Hospitalizations, we have had 1,235 hospitalizations at this point, and 158 of those were ventilated, and 384 were ICU admissions. And so yes, absolutely, those numbers are out there. And you guys, we would love for people to go on that website, because there's so much information about the statistics, the percent positive, the rate of testing per county. There's so much information. The race, demographics, and ethnicity demographics. So these are all very important things. So we are luckily seeing that death rates are going down and hospitalizations are going down. And we know a lot more. What I will say is we know a lot more in July 2020 than what we knew in March. And we know that from other countries, we know that from other states. And so we have really watched what was going on in other places, so that we can know better how to treat people, and so that we can keep those death rates down. And even hospitalizations, we are figuring out who needs to be hospitalized and who didn't. Previously, we were probably hospitalizing anyone because we didn't know. We saw people crashing quickly, and so we said, okay, let's get, oh, thanks, Doug, put the website there. So we would put people in the hospital, and because we were afraid, we weren't sure what was going to be happening. So yes, absolutely. People have said, well, maybe it's the warmer weather that's making people not die or not be as sick. Is the virus getting weaker? We don't have any evidence necessarily that the virus itself is changing or becoming weaker or any of that stuff. We do know that we have learned a lot, and we have learned a lot in about ways to take care of people to hopefully save lives.
Yeah, and we've been, by we, I mean doctors, not myself, but we as a nation have been trying out new treatments. The dexamethasone.
Yeah, like steroids, antivirals, they
also all sorts of stuff that we're trying out that are helping those health outcomes, and that's great. There's no good cure at this point that they've proven. There are good prospects, but
there are a lot of ways to support people while they are in the hospital.
Yes.
As far as being able to help with oxygenation and things like that. Yeah. So really great question. See, ask questions and it leads to other discussion, and then maybe other people have those questions. So thank you. Keep them coming.
Yeah, and active cases really improved and recovered quickly. That's good. Yeah, so recovery criteria. I want to go over a few things just that have come up in the last couple of days. Recovery criteria for those who are isolated anywhere, but luckily none of our cases have had to be hospitalized outside of that first one a little bit. But our last 3 cases, they were all able to recover at home. They are the recovery criteria. Sorry, I have to get my thoughts in line. The recovery criteria is 10 days from symptom onset with 3 days afebrile. So at least 10 days. If you have a fever on the 10th day, then it's going to be at least 13 days. That's how that works. So whichever's longer. Luckily,
sorry, I was just going to say, we do have people who, are people that we're seeing that are sick for even weeks to months also.
Yes.
They're kind of talking about them being long haulers, so it's really like, it varies so much. That's why it's a tricky disease too. And it's not all just the people that are at high risk or vulnerable. We're seeing this happen in different age groups too. But of course we have the people that are at the highest risk with the chronic diseases. So,
yes. But
yeah, I mean, for the most part, people hopefully are hitting that recovery period within a couple of weeks.
Yeah, and I think our last case, I mean, they just have, a week or less left on their isolation. So isolation is for ill people, infected people. Isolation means infected, and quarantine is for those who are exposed. So that's the difference.
One question that's come up, look how we can still look dreamily at each other through plexiglass. Again, if you guys haven't seen our new plexiglass wall, look at that. Hey.
Oh, shout out to my cousin Matt, who sold me this.
Oh, see,
from
he made you pay for it? Come on, man.
Well,
I'm just kidding, Matt. Come on. Just kidding. No,
Ambrose Sales is where I got it.
Oh, yay.
Mm-hmm.
Just in case you're looking for a piece of
In
plexiglass.
case you're looking for a plexiglass barrier. I can't even talk.
So one thing that came up was, okay, so let's say somebody I was in close contact with tested positive. So can I just go get tested and then I don't have to quarantine for 14 days? Because no one wants to quarantine for 14 days.
No, except me.
Yeah, except for sometimes when we want to quarantine for 14 days. So the answer is no. It is not a substitute. A negative test is not a substitute for a 14-day quarantine. And the reasoning is, and we'll kind of team effort this one, is because the test itself is more of a snapshot of that day. There's a reason that we do a 14-day quarantine, is because some people don't test positive until later on in that course. Some people will never develop symptoms. Some people will develop symptoms at day 12. I mean, there's a lot of there's a big time frame in there where people may be asymptomatic. They may test negative. They may not be developing symptoms. So we have to be very careful about that. So it's great if you want to get tested. Great, do it. But don't let that give you a false sense of security that, yeah, cool, now I can go out and about and just do whatever. I don't need to quarantine. So what else on that one?
I think you really covered it. I don't have. Yeah.
Yep. Okay.
Yeah.
Alrighty.
What's your take on youth sports tournaments like baseball at this time? Seems like communities and youth sports teams or groups are moving forward regardless of numbers. Smart, not smart, what's the scoop? That is a really good question, Jay. Thank you so much.
Class of 98 rules.
So, I would say anything that puts you in close proximity with people that you are not normally in close proximity with is a risk at this time, in any situation. Some sports are easier to social distance in. Golf's an amazing one. You either walk or you ride in a cart with someone that you are already a household contact with or whatever.
So we should all take up golfing. Jay, you want to go golfing?
Baseball and softball, the dugout is the biggest. That's my biggest hang up on that one. That is pretty close proximity. When your team is waiting to bat, when you're on offense, it's much more difficult to socially distance in there. On base, it's a little different. I think the most important thing is to recognize the risk and do what you can to kind of mediate it.
And educate your kids, you know,
And educate your
the
kids,
teens.
yeah.
And we need the coaches on board and everything to keep everybody safe. So it's definitely higher risk if you are if you're in close proximity, but being outdoors where we can spread out more is also definitely better. So I did want to give a shout out. I see Dr. Steinschauer on here. She is one of our pulmonologists in Wichita. So she is leading the charge around there, and she spoke out at the Wichita meetings about the mask mandates, and so we're honored to have you on here, Dr. Steinschauer. Thank you. Also a classmate of mine back in the day. Let's see. Talk at length about positive predictive value, false negatives, and also sensitive testing. Doug.
He's quizzing you.
He is, Doug. Dr. Nunemaker is also one of my classmates from med school. Feel free to put in all your comments on that in the comments if you would like. But actually, it's a really great point in that we can still see false negatives with our tests. We talked in the past about PCR testing, which is your most sensitive, meaning you're going to have less false negatives, and it is very specific, meaning you are not going to have a lot of false positives. So that's PCR. That's the original one. The swab. This one. Not this one, but this one. And then you have antigen testing, which also goes in the nose, but it is a little less sensitive, and so you can have more false negatives there. If you're very low risk, maybe some people are doing that for pre-operative testing to make sure that you don't have COVID, but we don't have a high suspicion for you to have COVID. You might get an antigen test, and that's going to be more like in the 80. Some tests are 85 to 90% range in there. And then our antibody tests. Those are the ones that are tricky, that we still are not able to say for sure what those antibody tests mean. So used in combination with a PCR test, they can give us more information. But antibody tests by themselves, they're giving a lot of false positives because it might react to other coronaviruses in the coronavirus family rather than SARS-CoV-2. And also, we might be seeing more. We don't know what our antibodies do after we get infected with coronavirus. So I know we've talked about that a lot, but just an update, because we're still there. We're still where we want to use antibodies. We have a lot to learn from the antibody testing. I saw that like at the blood drives they're doing antibody testing actually. So it's fine, but just know that it's not going to give you all the information you need. So if you come back and it's positive, it says, yes, I have antibodies to coronavirus. Don't assume that means that you're going to go out there and not get COVID-19 because we still don't know. So just be careful. That's what we're saying. Be educated before you get any testing done, what it means, and then make sure that you know what it means and what it doesn't mean afterwards.
Yes. And after throwing that curveball, he actually answered a question. Thank you, Dr. Nunemaker. Deb Wells asked that she heard about a spit test today rather than a nasal swab. It was mentioned as a better option for testing children. Widespread availability here, and our thoughts on it. So yes, there is. They've actually come out with home tests where you can like mail in your. Do you mail in your saliva?
Yeah. So they'll mail it to you. You mail it back. You spit in it and you mail it back. It's a thing. But yes, less accurate testing children. So yeah. So when they have those spit tests, they still are decent tests, and that's where we're trying to get to the point of saying, okay. Before we just talked about how we were testing everybody who had multiple symptoms of coronavirus. Now we're testing people who might have one symptom or maybe vague symptoms. I just don't feel good, or I have a fever, or I've been throwing up. And now we're trying to get to the next level to say, okay, in the general population, what is the incidence of coronavirus. So that might be someone sitting at home on their couch, never even thought about getting tested, but hey, look, I opened the mail and here's an Entertainment Weekly, and also, I don't know, that's the magazine I get. Anyways, here's a Sports Illustrated, and here's also a saliva test. I might as well spit in one of them, might as well be the saliva test. So, and then we can gather information. But it really is more to get information from the general population, get a decent idea.
Yeah, and I do want to point out, Dr. Nunemaker makes a comment that this is a novel virus. We've not seen it in humans before. Novel means brand new. And so he's absolutely right. All these tests they've had to been made just like on the fly as we're trying to figure out what works. So we all don't know, but science works because you keep testing things. So you might think something's right, and then you test it again, and you test it again, and you test it again, and then you see if it works. And so some of the things that we've said at the very beginning of this pandemic aren't necessarily true now. You can see that in the treatments. We thought hydroxychloroquine might be the thing. Then it was the antiviral that everyone...
Remdesivir.
Yeah. And then the dexamethasone.
That's okay. I'll be in charge of all the
too many long names. But I know that people are like, oh, well, you said don't wear masks at the beginning. Well, that's what we were told. Yes, we did say that.
And that's what the scientists thought at the beginning.
Mm-hmm.
And it's not untrue. What they said, masks aren't, when we wear cloth masks that are not N95 masks, those do not necessarily protect you the way that we, protect you from the virus completely.
Right.
If you wear like a cloth mask or surgical mask.
Yeah.
So that's what we were saying. But then we realized, okay, if we can then use those cloth masks to decrease the droplets, then they are useful, but everybody has to do it. So the science is still true. It's just the way that we are looking at it as we gather more information and we gather more data. There's a lot of research now about the effectiveness of masks and how masks can cut down, like in one study, they showed that masks were 79% effective in decreasing the transmission of COVID-19, which was higher, and this is a British study, but this was higher than even hand washing. Like, how crazy is that, right? So we're getting a lot of new information, so stand by, but keep listening and keep reading because there's a lot of good stuff out there.
Yeah, I hate to say this is a fluid situation because this is a droplet transmission, but it is because we're learning every day and we're learning really quickly and we're changing things. Things are changing every day. There's a question based on the positive tests in Cherryvale, Coffeyville, and Erie from their weight rooms that have canceled those programs temporarily. What is your best guess as to what will happen if a student tests positive once school starts? That is an incredibly good question. KDHE and the Kansas Department of Education have set up a joint meeting between school boards or school superintendents and health department officials and these folks, health officers, and we have a meeting this coming Thursday to figure that out. I don't have a good answer.
We know there are, so we also have, and we kind of mentioned this, we also formed this Kansas COVID work group for kids and that's made up of different healthcare professionals, pediatricians, family doctors, school nurses, things like that. Because we know that there are so many different scenarios, right? So a second grader tests positive. Who can we tell? What are the confidentiality rules? Do we shut down that whole class? Do we shut it down for a week? Do we shut it down for a day? What if the teacher is positive? Who gets that information? Do we tell all the parents? We're saying all this because we know that there are so many uncertainties and we're still trying to figure out what that looks like. Nobody has the right answer. We're looking toward other countries and other states, what they've done there. So we're doing our research. We have, again, the benefit, if we can call it that, of seeing what other countries and other states have gone through. So we're still trying to go through basically every scenario. When do you send a kid home? What about the kids who always have stomach aches? If they have a stomach ache again, do we send them home?
How many kids do you test? When do you test a kid?
Exactly.
You
Lots
know,
of stuff.
So many options, and
So we're just going to say we're going to learn a lot. I think as these meetings go on, and there's going to be a lot of trial and error, quite honestly. And we're going to just in the whole process, we're going to keep kids safe. I mean, that's going to be the biggest thing. So so know that our schools, like, they're having us discuss COVID at their regular meetings. Our schools are buying masks for their kids. Our teachers want to be safe when they're teaching, and we want to keep our teachers and our kids safe. So these discussions are being had. They're just really tough to figure out what to do.
Yeah, and Lou, we really want school to start in August. He says with the uptick in trends, do we anticipate school starting? We really want it to start. Our kids need to be in school. They need to see their teachers. They need to see one another. But again, we don't know exactly what it'll look like at this point. It could be staggered start times. It could be cohorting. It could be, so many different options to keep our kids as safe as they can be, and keep our staff as safe as they can be, because we know that children generally don't get as severely ill. So, but our teachers may. So we don't want that either. So we definitely want to keep our students and our staff just as safe as we can, and so that's why we're having these discussions with superintendents and the Kansas Department of Ed.
And we also know if school doesn't open, we know that means parents have to maybe take time off from work. All kinds of things go into that, and so we want to make sure things happen safely for the sake of the kids, the sake of the teachers, and the sake of the parents, and really the economy, to have people being in their work environment where they should be.
Yeah, this is an interesting question.
Let's see. In regards to wearing masks, is there a specific negative trend threshold that we are striving for before you and your colleagues will recommend only using masks in the capacity they were used prior to this pandemic? So that is a great question, and we've been asked that a couple of times. Like, at what point do we say no, we don't need masks? So what I would say is we are in this for the long haul with coronavirus. And Destiny mentioned earlier that medications and the different facts that we get through science, these things need to be tested and tested and tested. Vaccines are the same. We would love for a vaccine to come out soon, but we know that they have to go through so many tests and then also be tested in humans and then figure out what kind of side effects are there, that kind of stuff. So coronavirus is here for a while. So we say that not to scare people, but to just say, like, if we have the mindset that it's not just business as usual, we're not going to just get back to normal soon, then we know how to adapt our lives to the world we're living in right now. As far as masks, the reason that a mask mandate was put on by the state and why some counties adopted it is because right now we are seeing an upward trend in our cases, like Destiny mentioned, an upward trend in our cases in Kansas and in the United States, in so many different states. I think one good thing to mention is this, our little sticky note. Do you want to mention it?
We are officially on someone else's travel mandate, New York, New Jersey, and Connecticut. If you live here and in Kansas and you travel to New York, New Jersey, or Connecticut, you will have to quarantine
while you're there.
While you're there. Oh, the whole time you're there?
Mm-hmm. For 14 days.
Oh, for 14 days, yeah. Mm-hmm. Yeah, so
it's very telling. Kansas is like, hey, if you go to all these places, make sure you quarantine, because those are the naughty places. And they're not really naughty, obviously. Like, they're the places where numbers are going up. We are now on other people's lists in Kansas. And so that's, I think, very telling for what our numbers are doing. So back to the mask question was, the reason a mask mandate is being implemented now in the state and in various counties is because we want to make that upward trend go back down, and we need to see it going back down. And then hopefully we all then would realize that masks are a part of what our future kind of looks like. Not all the time. Nobody expects it to be all the time. But when we're in close proximity, or when we're not able to social distance, when you don't have a piece of great plexiglass like this.
Thanks, Matt.
So there's not a great answer to that, except that right now our trends are going up, and that's not okay. So that's why we're being extra careful in talking about masks so much.
Yeah, and I would like to say that just because there's not a mask mandate does not mean that you shouldn't wear a mask.
In our county.
In our county, yes, I'm sorry. Let me rephrase that. Just because there's not a mask mandate in Wilson County does not mean that you shouldn't wear a mask. And I would challenge you to wear a mask, to social distance, to do all those things that we know will slow the spread of disease and keep those around you more safe.
And there is still a resolution out there in Wilson County that we highly recommend masks. And so don't forget that part. That's really important too, is that our county commissioners believe enough in masks that they really strongly recommend it. Mm-hmm. And we hear so many people saying, yeah, it should be our choice. And that's great. So now it is our choice. So please make that choice to wear masks, because that's the most scientifically proven way in all of this that we have found that we can decrease the transmission of COVID-19 is through masks. And that's what all the research is showing, and that's why the numbers that we can see from other countries and other states, like that's why that's valuable research, because we can now use it,
Yeah.
I think you have.
So, Lisa, I'm sorry, we hadn't gotten to your question yet, but the question is, will it be mandatory for all kids to wear masks? If so, how will that work with parents that don't wear masks? So, again, we aren't sure. We have we're having those discussions now. Thinking out loud, if all kids are required to wear masks, an online option could be available. I don't know that yet. It really would just depend, on our conversations we have with KSDE and KDHE and the superintendents in the coming weeks.
All right. And then Dr. Nunemaker, you also mentioned herd immunity, and I think people talk about that a lot. Like, are we getting close to that? That was a question we were asked yesterday in the county commission meeting, and the answer is no. So as we talk about the numbers that we're seeing in Kansas, we are at a very, very small, we have a very small percentage of the entire population of Kansas that is,
yes.
That has even been infected at all. And we're saying, and I don't know what the actual, we'll come up with the actual percentage.
0.01% or something like that, but I'm not sure.
It's like 0.5% or something. I don't know. Anyways, it's very low, like less than,
yeah,
I think it's
half
less
of 1% or something. I can't remember.
So the reason we say that is herd immunity for this virus, because of its infectivity, like its ability to infect others, we need about 70% of the population is our best estimates for us to have herd immunity. If we are not even to like 2%, that's a long ways to go. So right now, without a vaccine, that is a difficult goal to reach before we see deaths and things in that in the goal to get to 70%. So we really need, and Dr. Nunemaker said 60 to 70%. Let's see. So we really need a vaccine, because otherwise all those people getting infected, in that number, people will die. And we understand that about disease. We know people will die, but everybody who dies is somebody's mom or brother or grandma or child, and we don't want that to happen.
No. And that's true, Carrie. Keeping a mask on a kid for 8 hours is unlikely. I don't know how that's going to look exactly. It may just be in the hallway and they're cohorted in classes. I don't know how that looks exactly.
Some of the things we've talked about are just like in passing, in the hallways, and because we know that is going to be hard. It'll be distracting for kids to have to wear masks. They do it in other countries. They'll get used to it for the most part. Probably not for 8 hours, but we fully are aware that putting a mask on somebody, a kid of any sort, and expecting them to wear it for 8 hours is not going to happen. So our school leadership in Wilson County, they get that part too, and so does our state leadership.
Yes. Yeah.
What else we have?
What else? That's everything, I think.
Oh, did we have some more stuff here?
The only thing that I wanted to mention really was, every time we announce that we have a new case, we get calls wanting to know what town that person lives in, if a person where that person works, all these different things, and we know a lot of rumors go around, and I just want to discourage that. Because someone is infected with COVID-19 or has been exposed to COVID-19 does not mean they did anything wrong. They could have just gone to work one day and gone home. And I want to be very clear that Juan was
Hi, Juan. Oh, look at that. Juan was a foreign exchange student when we were in high school, and we're still buddies. Hey, Juan.
Hey.
Okay, sorry, go ahead.
But no, sorry for the sidebar. This is very serious.
Very serious.
So I want to be very clear that we at the health department will do everything that we can to protect the anonymity of those who have either been in quarantine or are in isolation because they're infected. We will give the least amount of information just to keep people informed, but we will not give away anything that dictates who they are. Not dictates, but gives away who they are. I also would encourage anyone who is informed that they are a contact. When we inform people they are a contact, by the way, we don't even tell them who they're a contact of. We just say you're a contact. We would encourage those who, if someone is infected with COVID-19 and they reach out to you and say, hey, I was infected, the health department's going to be calling you, keep that to yourself. Those folks deserve that. They deserve that that privacy and that anonymity. And I would just encourage you to put yourself in their shoes. If you were the one infected, would you want everyone to know? And if you do, then put it on Facebook and everyone will know. But if not, I encourage you to please not do that. That's the one thing. That's my public service announcement for the day.
And Carrie, you mentioned like other places are sharing more information. Basically, we have to abide by the laws here in Kansas and what those confidentiality laws are. They actually covered those in this last special session of the legislature, and so we want to make sure that we are doing a service to our first. I guess our first job is to take care of the person that is infected. Our next job, like 1A, is to protect the public. But part of that protection of a person is their confidentiality. And whoever they choose to share with, like Destiny said, that's their decision. But our job is to care for them and then care for the public. And we can do that still through confidentiality and keeping people safe. So I think that was a great public service announcement, Des.
Thank you. No, we just get a lot of that, and I just care for one another, that's all.
Yeah.
I watched a video the other day saying that WHO stated that the virus doesn't spread from person to person, assuming fake article. Yeah.
Yeah. It spreads from person to person.
Yeah.
Just in case you saw anything.
Like Supervisor's
otherwise.
candy.
Oh, thanks. Thanks, sister. All right. Okay, any other questions? Oh, was that? Thank you for the shout out. Oh, you guys. And you guys have been, while we're waiting for some other questions, you guys have been great. I know it's been challenging. We know it's been personally challenging for us and professionally and all that. But we know it's been challenging for everybody. Mm-hmm. It's been challenging for businesses. It's been challenging for people who are nervous that they're going to get sick. It's been challenging for people to just go to the grocery store, and what that feels like now to have to, it used to be something that we didn't even think about, right? So we know businesses are hurting. We know that people are making hard decisions, and it's a tough time. So please, please, please support each other. We have gotten so much love and support from people, so thank you very much. But please support each other, because it's an easy time to let this stress get to us and manifest as, as ugliness or as blame or anything else. When we can use this uncertainty, we can use this time when we don't know, and we can turn that into love and respect and care, for other people. I mean, we're not going anywhere, right? So you might as well pick up a phone, text somebody, check in, make sure they're doing okay, because it's tough on people.
It is. It's been incredibly hard on people, and yeah, we realize that.
Okay, last call.
Yep, I'm not seeing anything. Lots of shout outs. Thank you guys
Thank
very,
you
very
guys,
much.
Really. And we're going to do this again in another couple of weeks with our plexiglass, just in case anyone got here late. Look, Destiny's cousin Matt made it for us. So
Yeah.
look at that. I did have some spit speckles. See, I didn't even know like that was a thing. That like I apparently spit sideways also or something. But no, we'll be back in a couple of weeks. If you do have questions for us, please don't hesitate to ask. Again, like Destiny said, we'd much rather answer questions than, I mean, we see a lot of rumors and things on Facebook that we would much rather you ask us about, and we will always, always answer. And we are not going to hide things from you guys. You will know as much as we know.
As long as it doesn't violate HIPAA.
As long as it doesn't violate HIPAA and confidentiality. So, all right.
All right.
I think that's it.
I think we're good. Well, thank you so much, everybody. You guys
Take care.
Have a great couple of weeks.
All right.
Call us if you need anything.
Thanks. Bye-bye. Oh.